dancers, I'm Dr. Divya Raghavan, and today we're going to talk about the neck. I'm going to start by talking a little bit about the anatomy of the neck. Then we'll move on to talk about the common injuries that happen in the neck for dancers, and then end by teaching you a few stretches and self-care strategies to help relieve neck pain. So anatomy. So the cervical spine is made up of 7 vertebrae, and these vertebrae are very small in size, and the human head could be up to 8 pounds heavy, and so the neck kind of carrying the weight of the head can deal with a lot of stresses. Now if you add like heavy props on top of it, or do movements like hip hop dancers do where you're spinning on the neck, or movement like that for Indian classical dancers, again different muscles are being overused and can lead to injuries. So the common injuries experienced by a dancer for the neck could be anywhere ranging from muscle strains to ligament sprains, to stress fractures, nerve impingement. Sometimes that nerve impingement can lead to tingling and numbness going down the arm into the fingers, known as radiculopathy. So these are the common injuries that are usually seen in the neck. If it's a muscle strain, then usually there'll be spasm in the neck, there'll be achy discomfort, stiffness, difficult to like move the neck side to side. If it's a ligament sprain usually happens with like a quick movement, like whiplash injuries while driving can cause ligament sprains. Similarly, any kind of quick movement can cause ligament sprains. The ligament sprain and a muscle strain has very similar symptoms initially, where there's muscle spasm, achiness, discomfort, lack of mobility. As the muscle spasm goes away, if you're taking like muscle relaxants, which is what's commonly prescribed by doctors when you go to them with neck pain, then the inherent instability in the neck becomes more evident, right? So initially it's all stiff, then you feel that there's more clicking and cracking, and you feel that the neck is not in the right position, or the head is not in the right position. Sometimes muscle strains and ligament sprains can also lead to tension headache or cervicogenic headache. So headaches sometimes could be the prominent feature. Sometimes we also see symptoms like vertigo, nausea, vomiting, dizziness for people with chronic neck pain. And then the nerve impingement symptoms, as I said, can cause tingling, numbness in the hands, fingers, weakness, loss of dexterity. So a lot of issues can arise from neck pain. So it's really important that if you're having a neck pain or had a neck injury and it seems like it's not getting better, then definitely feel free to contact me. Currently, I'm also offering tele-rehab visits for my patients, and I also offer free phone consultations, or you can come in here to my clinic in Sunnyvale and we can talk it out and see what's going on. Now, let's talk about self-care to make sure that your neck stays strong, healthy, and flexible. So let's start by learning some simple stretches for the neck, right? So one of the good stretches I teach my patients and also do myself if I feel that there's tightness in the back and the side of my neck is known as an upper trapezius muscle stretch. So upper trapezius is this muscle, and usually you'll find yourself kind of like feeling achy or tight in those muscles. So you're going to keep one hand behind your low back, take the other hand on the side of your head, and then slowly tilt your head to the side. Once you feel a stretch on the side of your neck, you're going to stop pulling and then hold it for anywhere from 15 to 20 seconds. Make sure you breathe slowly while you're doing the stretch. Try not to yank or pull your head very hard. If you feel that your neck muscle is slowly giving way, or slowly becoming more flexible, then you can pull it a little bit more to get a little bit more of a stretch. Be careful when coming off the stretch. Come nice and slow and don't try to come back very fast. And you can do the same thing on the other side. And it's okay to do multiple sets of these exercises, and also do these exercises multiple times a day. The other muscle is the levator scapulae. This is the muscle which is goes from the back of the neck and then attaches on the top part of your shoulder blade or scapula. And if you go for massages, you will see, like, if the massage therapist puts like a pressure on that area, it feels really good. Like, it hurts, but it feels good. And so this is a stretch for that muscle. It's slightly on the back. So what you do for this, to stretch this muscle, is you turn your head to the side and then look down, reach that hand behind your head and pull it a little down. I'm trying to pull my chin towards my collarbone. Again, feel the stretch, stay relaxed, breathe. If you feel that the muscle is loosening up a little bit, you can pull it a little bit further. Again, be slow to come off the stretch. Another important stretch, which is not directly on the neck, but is very important for people with neck pain, is stretching your pectoral muscles or your pecs. Now these muscles are in the top front part of your chest. If the pec muscle gets tight, it kind of pulls the shoulder forward, makes you have kind of this rounded back, forward head slouch posture, can also kind of aggravate neck pain. Again, commonly seen in people who work at their desk or do tasks which are in front of the body. Usually dancers are supposed to have really good posture and are able to keep their shoulders back and down, but still, you know, we dancers can also fall victim to pec tightness. So I'll show you a very simple stretch, again, that can be done multiple times a day very easily. You will be using a door frame to do this stretch. So you're going to hold on to the door frame and then maintain a slight pull on the door frame and then turn your body away from it to feel a stretch in your pec muscle. This stretch I would advise to hold it for 30 seconds, so longer than what you did for the neck, because this muscle takes a little while to kind of stretch out. As you feel the muscle loosening up, you can kind of go a little bit more into the stretch and turn a little bit more and hold it like that. Oh, feels really good. Feels like I need to do this stretch. Now this stretch can also be done with different positions of the arm. So you can raise the arm up to get into the lower part of the pec. Same way, you pull and you rotate and hold. And then to feel it more in the upper part of the pec, you can hold the arm lower on the door frame and then again pull and rotate. Hold these stretches for 30 seconds each. You can do all three of them, or if you feel that, you know, only certain part of your pec is tight, then you can just focus on that area. Really a really good stretch to do right before your class or right before your performance, because if the pec loosens up, the whole posture kind of improves. So now I'm going to show you a stretch for your mid back. The mid back and the neck are connected, right? So a lot of time mid back tightness or stiffness can lead to worsening of an existing neck pain or can actually be the cause of neck pain. I've seen a lot of patients where their main symptoms are in the neck or they are having those tension headaches I previously talked about, but it's mostly coming from the upper back and mid back being stiff, right? So I'm going to show you a very simple foam rolling technique. Foam roller, sometimes a friend, sometimes a foe. I love doing foam rolling, but again, if your muscles are really tight and you're trying to use the foam roller, it can feel really painful, like a deep tissue massage, but then it'll give you relief. Here we are mostly working on getting the spine to move, so it's less about the muscles and more about the joint mobility. So you're going to keep the foam roller in the middle part of your back, right? And then you're going to raise your hips up and then roll up and down. You can do this about 5 to 10 times. And the next thing that you're going to try and do is bend backwards. Here I'm trying to touch my head to the floor, hold it for a few seconds, and then come back up. And come back up. One of the things I would like to tell you in this one is make sure that your low back is not bending back too much. It's more of a mid back, upper back stretch. So keep your abs engaged while you're doing this stretch. We talked about stretches and mobility exercise, right? Stretch for the neck, stretch for the pecs, and a mobility exercise for your thoracic spine or your upper and mid back. But one of the things that people commonly miss about neck is that it's very important to get stability also in the neck. So I'm going to describe these two exercises, which will then show you, also demonstrate the exercise to you. So the first one is to help strengthen your deep neck flexors. These muscles are in the front of your neck. They are deep muscles, and they help with a chin tuck movement, right? If these muscles are strong, you'll keep your head in a more like aligned and chin tuck position instead of being in a backward tilt position like that and chin forward position like that. And a lot of people, again, in my experience, I've seen this, have weakness in the muscles on the front of the neck, right? So these are the muscles that need to be stabilized. So the exercise I will show you will be in a lying down position, tucking your chin in, like creating a double chin, and then raising your head up, holding that for about 5 to 10 seconds, maintaining that position, and then relaxing. The next strength exercise will be more for your mid back or your scapular retractor muscle. So the scapula are your shoulder blades. Retraction of the scapula means pulling the shoulder blades back and down. The scapular muscles again help form the foundation for the neck. If the scapular muscles are not strong, if your mid back muscles are not strong, then again you will feel that your neck is not stable, and you'll feel more aches and pains in the neck. So I hope you enjoyed watching these videos and learning exercises for your neck. If you have any questions, feel free to contact me. And then if you want to learn more about our tele rehab program, click on the link posted below. Thank you for watching.